So welcome to this webinar on interpreting Cambodia's COVID statistics. What worries you the most about this outbreak? So the results of the polls say that people are most worried about two things. Number two was they're not testing enough. That was the second most voted for item, so we can't know the true extent of the cases. But the most popular one was that Cambodia seems to be going into the direction of expanding as much as European and other Western countries have. So I'm going to tackle both of those things later on in this talk. There are 30 COVID deaths so far, and this is a very small sample size still, so although some are young, we can't really derive any meaningful conclusions out of it quite yet, because although the number is significant, it's not large enough to be able to make any statistical inferences based on that. But one thing that I would like to note is that actually 50% of the deaths so far have been from people who have been diagnosed only 3 days prior to dying, 3 days or less prior to dying, some of them being dead on arrival or dead very, very quickly afterwards. So I did write an article for the Globe, Southeast Asia Globe, in late January called Cambodia's Hopeful COVID-19 Statistics. And I wrote or contributed to a similar piece for the Khmer Times. I gave a couple of talks about this in early February as well, before the now infamous 20th of February incident. Since the outbreak, though, I am publishing every day on social media, on Twitter and on Facebook, a dashboard with some key statistics, and I'm also contributing towards Cambodia News in English, CNE, who I work with very, very closely on this. I have a YouTube channel that gets 12,000 views per month, roughly. Is under my name, David Benaim, and if you want to follow me on Twitter for my daily updates, then @DaveBenaim is my name on Twitter. Professionally, I am a chartered accountant who became a Microsoft Excel MVP, which means that Microsoft considers me to be in the top 100 or so Excel people in the world. I run a firm called Excel Consulting here in Cambodia, and we've worked with over 120 organizations in tech solutions, a lot of which are around data systems. And I've done corporate training with over 1,500 people, mostly in Excel, but also in PowerPoint, email management, Power BI, etc. So just to clarify, I am not a professional in any of these fields. Although I do some research on these, I have never studied a structured course in any of these fields. I do want to give a big thanks to a couple of people who I have only met virtually, never in person. Cambodian News in English, who I collaborate with multiple times a day. They are able to decipher a lot of the obscure news sites in Khmer and translate them, and also they have a lot more information about locations and regions in Cambodia that I have, and they work with me all the time. Dixie Can on Facebook makes loads of really, really useful maps about restrictions, regulations, prohibitions, and travel bans around the country. And Nan Bot is a Twitter person who is posting many, many, many times a day about news in Cambodia, and has done so much with COVID and is always the first person to post about these things. So thank you to all of these three people. I will decipher complex data during this talk, but there is a lot to get through, so let's get started. This talk will cover a combination of COVID statistics and practical skills that I will teach you about using technology better in desk jobs. But the predominant one will be COVID statistics. But I guarantee you'll walk away with something. So 6 things. We're going to look at vaccinations, the story so far, versus other countries, my data sources, COVID testing, and then what's next. So vaccines over here. In supply, there are 3.1 million vaccines in the country right now, including ones that have been administered already. And this is how it's broken down. So only 10% of them are non-Chinese vaccines. Sinovac is slightly more than Sinopharm. In terms of the distribution, what we've seen so far is that AstraZeneca has been given to diplomats, people in international organizations, older people, UN, etc. Sinopharm has been given to people in the government, military as well, and some civilians. But the majority of civilians are getting Sinovac. Sinovac is something that they are prioritizing now, and they're doing a very large vaccination drive to get there. So doses given to date to the 14th of April, slightly after when I gave the talk, 1.45 million first doses and 300,000 second doses. And they are doing this at a quite fast rate. Yesterday there were 75,000 doses given, and the day before there were 85,000 doses given. So it's pretty impressive the rate they're going at. The plan in terms of supply is to procure these numbers in terms of millions. So, as I said, they've had just over 3 million currently. They plan to get another million or so on the 17th of April, which is next week, and then go up to 5 million in May, and then in June go up by 3 million, etc., until they plan to have 11 million in supply by the end of August. In terms of which vaccine, efficacy is often quoted, but that's by far not the most important statistic. The most important statistic is the fact that people need to avoid getting hospitalized or dying. And most of the vaccines, from what we know, are 100% effective or near 100% effective at these. This is a quote from an article in Reuters that does quote the manufacturer's perspective, but it does say that it is near 100% effective at these things. Although that doesn't happen immediately, you get your first dose and that gives you low protection. Depends on the vaccine, but for most of them it gives you quite low protection. And then the second dose is usually about 4 weeks after the first one. You have to wait around 2 weeks for it to get to the peak effectiveness. So it's roughly about 6 weeks between getting the first dose and being protected if you get it after 4 weeks. So don't be surprised if you see cases of people getting infected despite having taken one vaccine, because that is actually expected. What we should see after here is that there are some people still getting infected, but hopefully we shouldn't be seeing severe hospitalizations or deaths at that stage. So another quiz question: if one person has COVID, how many will they infect? How many other people? Assuming there's no government interventions, as an expected amount everywhere in the world. So the majority of people for this actually voted it was 12 to 16 days. My options were 0 to 4, 4 to 8, 8 to 12, and 12 to 16 days, with the majority of people voting for the highest one. But this is a statistic that is often quoted in epidemiology, something called R0. So let's go into that and see how it looks. So the R0 of COVID is actually between 1.5 and 3.5. So it's actually a lot lower than the people voted in this survey. This is the number of people that if one has COVID, how many others are they expected to infect if there are no measures taken at all? So R0 is the unadjusted rate of infection. That can be adjusted from multiple things that I'll go through soon. But one of my favorite visuals is this one from informationisbeautiful.com, which shows this. Along the top, it's the percent of people who die, the death rate, and across horizontally, we have R0, the number of people you're expected to infect. And we can see that COVID-19 is roughly in this rectangle. Infectiousness 1.5 to 3.5%. That is the rate that I gave you, the R0. And the fatality rate is anywhere between 0.7 and 3.4%. I will note that this scale here is a little bit of a logarithmic scale. So the distance between this and this is the same as the distance between these two and these two, even though it's growing up tenfold. After this, it becomes a linear scale. So, for example, measles has 9 as the infectiousness rate, the R0, and has roughly the same death rate as COVID. Fortunately, it's quite rare nowadays, so we don't really see that. Most people have been vaccinated against it, so we've reached what's called herd immunity, and that is staying over here. But COVID is roughly the same as the Spanish flu. The Spanish flu, as we know, killed a lot of people roughly 100 years ago. Smallpox, though, is much, much higher in the percent of people who die, and also much higher in the R naught. So it's over here. Now, this doesn't demean the effect of COVID-19, because COVID-19 is something that is prevalent and we're not able to deal with. These ones are very, very near controlled, smallpox being eradicated completely. But I find this visual really interesting, so I wanted to show it. So if we have R naught, we can amend that in a number of ways. We can reduce R naught with lockdowns or curfews or any kind of restrictions that are imposed by the government on social gatherings and things like that. So green means R goes down, because you're likely to infect fewer people if there are lockdowns than you are if there are no restrictions taken. Next, we have sort of things the way they are. Urban centers will always increase R naught, or they will increase R. So in rural areas, people are way less likely to get the virus than in urban centers. And next we have the temperature. So it's strongly believed that the cold temperatures will mean that R will increase. So people are more likely to infect others in colder temperatures than in warmer climates. But I'll talk about that a little bit more later on. It's not confirmed exactly why, but we are seeing this pattern. Human contact, any kind of human contact or touching things do increase it as well. That's why we take measures like taking masks and trying to avoid handshakes and other things, etc. So in terms of in-country transmissions, Cambodia in 2020 did very well. They only had 22 in-country transmissions between March and April when the first outbreak happened, and then that was contained because it wasn't continued, even though the number of measures taken here were less than a lot of other countries that had a big outbreak. And then in November, December, we had the 2 November incidents that caused 45 local transmissions, 4 in the 3rd of November incident, and 41 in the 28th of November incident. But again, that was managed quite well and didn't end up causing a crisis. Throughout 2020, if we think about R, how we get from R naught to the adjusted R, this is something that's called a waterfall chart. Really love this kind of visualization. It shows you the beginning point and the end point. So green means R goes down, which is a good thing, and red means it goes up, which means more infections happen. So the weather and the cultural attitudes that people have work well to reduce R naught. However, the fact that large events were not banned means that it went up a little bit, and then we get to the adjusted rate of R. But the key thing that every country needs to try and do is to keep this below 1. So if R is kept above 1, then things will grow exponentially. These are the kind of curves that we're seeing in most Western countries. However, if R is kept below 1, then you get exponential decline, meaning that eventually the virus will go away if you effectively just don't do any other measures apart from this. And this is something that I believe was happening in Cambodia, certainly in March, April, where we weren't really aware of how many cases there were. The contact tracing in the November, December time was a lot better, so that was easier to contain, but I do believe that this happened. I haven't ever been able to accurately calculate R in Cambodia because the data that's given publicly is not necessarily enough for that, but it seems like this is the pattern that I've followed. Again, exponential decline means that eventually the virus will go down to 0 because there aren't enough people passing it on to others. The UK variant, however, is a key factor that's happened now, because the UK variant is what we're seeing for the majority of the cases from the 20th of February incident. And the UK variant increases the adjusted R value, as we know. So it increases it by around 0.7. It's not known exactly. Some studies say it's actually higher than that. Remember, it was between 1.5 and 3.5 to start, so increasing it by 0.7 is actually very significant. And it means that bringing this to below 1 is actually much, much more difficult than it was without the UK variant. The UK variant makes up the majority of the cases in European countries. As we can see here, here's 50% mark, but it's making up close to 100% in many of these places. Fewer in places like Luxembourg, which actually has the South African variant being more dominant. But what happens over time is, because the UK variant is more infectious, because it has a higher rate of R, that will eventually become the dominant virus in that region, which means that people are going to pass it along more than the other strains of coronavirus, which means that it's going to eventually overtake and become the dominant one there. So this is kind of what we've seen in Cambodia. R will not only vary across countries, but it will also vary across micro-locations. So for example, if you have outdoor meetups, this will significantly reduce it compared to indoor gatherings. Anything outdoor means that COVID spreads a lot less. There needs to be like well-ventilated areas if it's going to be indoors to contain that. But outdoors is much, much, much better. In fact, to date, I read a study that there has never been a super spreader event that's happened outdoors. And we're talking about things like, stadiums and sports games and concerts, things that happen where people are sometimes very, very close together and there's a lot of these people at them. It makes such a huge difference in outdoor versus indoor. Also, rural areas will very rarely have a high rate of R. Like this is taken of the Cambodian countryside. If we see houses are far apart, then COVID is much less likely to spread in those areas compared to urban areas. Taking that into what we've seen in Cambodia, so there have been 3 outbreaks outside of Phnom Penh. I'll get back to Phnom Penh later, happening in these 3 places. So Sihanoukville had the first one, then the second one was in Kandal province, but not the area near Phnom Penh, but this place called Sampov Puan, which is near the Vietnamese border, and finally Bavet, which is in Svay Rieng. So these are the towns, the micro-locations in these, and they have reported a fair number of cases. So the key things about these, this is again until the 8th of April, the data. Phnom Penh made up 51% of the cases. This is before we saw the big spike that happened to 500 cases after it hit the factories and the markets. So Phnom Penh was just over half. Then we saw Sihanoukville, Kandal, and Svay Rieng were next. And the key things about these is that there are lots of casinos involved in these particular micro-locations in the 3 places. And other cases saw 6%. But even within other, the vast majority of those happened in Prey Veng with an incident in early on in the outbreak. Apart from that, across the other provinces, despite the fact that almost all Cambodia's provinces now have tracked at least 1 case of COVID, they've remained very, very low. So other countries do have sporadic cases, and they don't tend to go up. And this, in my opinion, is because the rate of R is able to stay below 1, given that it's a very rural area. People are not really spreading it to other people because the population demographics in these places are very different to the urbanized centers that we see in Phnom Penh or in these sort of towns that have casinos, apartment buildings, etc. So it's much easier to contain, and that's, in my opinion, why we're not seeing huge spikes across these places. Phnom Penh now. For 6.5 weeks, so almost the entire outbreak to date, it was very, very, very consistent around the 30 mark. Here is the cases of day by day. Each one represents a day. So 32 was the first day, then it went down, then back up. This was about 60 or so sometime in the first week, and then went back down long below 30, and then eventually sort of went like this. But what's significant about this is that it wasn't really changing, wasn't really increasing. I gave a webinar when we were 6.5 weeks in, and I asked, do you feel like Phnom Penh has gotten better or worse? And the majority of people said it's actually gotten a lot worse. But that's not the case at all. It stayed very, very consistent and been a linear trend line, as I'll show you. So the trend by week, as we can see for the 6 weeks at the beginning, Phnom Penh was kind of high at the beginning and then kind of regulated out. But again, the fluctuation here is very small. We didn't see that much change happen week by week. Sihanoukville grew. In fact, it had a couple of days with a huge number of cases, but that has since kind of evened out a lot. Kandal around week 4 was at its highest, and then Svay Rieng was rising towards the end, so in week 6. And other hit in Prey Veng, it was the highest, but note that these are only 6% of the cases anyway. So case by day and by province for the last 2 weeks before the big change looked like this, with Phnom Penh being roughly consistent, always having some cases but being very roughly consistent, whereas Sihanoukville had the huge uptick here and the days before and after. Svay Rieng in the later times was the place where we were seeing the most fluctuation compared to the others. Cases were growing linear. So in the days from the 19th of Feb, 45 days after that, 6.5 weeks, you can almost draw a perfect straight line through this. This is cumulative number of cases and days across. So yeah, it looks almost exactly like a straight line. And even the blue one nationwide is not perfectly straight, but it is still quite a linear trend. We did see an uptick here. This was around the time where there were 150 cases in Sihanoukville, but that did kind of even out, or it took a little bit of a step change, but still continued to remain linear more or less. And then suddenly we had the big jump. So after that, we see that it jumps up quite a lot. Fortunately, the jump has not persevered. The first 2 days on Friday and Saturday last week were very, very high, but after that it's kind of evened out. It's been much fewer cases since, which is very, very good. Even in the couple of days since this, they've also remained more or less about 150 to 200 per day after this. It is still definitely a step change from what we were seeing before last Friday, but fortunately it's not as high as the big numbers we were seeing on Friday and Saturday, the first 2 days after the step change. So what happened here? What happened was, for the step change, that COVID hit the 2 places where it was always going to explode, because they are micro locations where R is going to be much, much higher. And that is markets and factories. So in markets, people are very, very closely tied together, particularly in Orusei market, which is a very tightly packed one. People are constantly touching things, exchanging goods, exchanging resources. It's indoor. There's little ventilation. Factories, similarly, people are working very close together, indoor location. People are touching things, passing them along a manufacturing chain, and it is a place where it's likely to grow. And then we already saw that in the casinos, where in casinos there is higher transmission. Again, it's indoors. There's a lot of people who are in a contained space. So those are places which are going to have higher transmission or higher rates of R in those micro locations. If I add in those days, the same chart we saw is completely belittled by what's happened since, which is these huge upticks. As I said before, fortunately, we are getting, since the 12th of April, we are getting slightly around this level, which is good. So that has been for 2 days since then, and hopefully that is where it should even out, because these two were much, much, much higher than anything we'd seen before, and have been much higher than anything we've seen since. So hopefully that shouldn't matter. I know that they are prioritizing to test people in the vulnerable places, in the factories in particular. So that is a good thing that they're reacting rapidly to that. So quick demo of how I did some of the things that I showed you. So Excel and PowerPoint, a lot of people don't realize it, have map charts. So you can select these two columns, go to Insert, Maps, and choose this. This has been around since Excel 2019. And then it will show you that map chart. If you want, you can add the data labels or the legend. The legend here is looking like that. It sometimes gives you this and you can press refresh to make it work. And it also works with, say, a category like this, a text value. You can go to Insert Map Charts like that. And then we will color code them in the same way. So that can be a really, really useful thing that you can do for mapping. Today it's giving me these internet issues, but usually it works just fine. I have another video where I talk about that on my YouTube channel. Another thing that you can do, and this works with provinces or countries, but I'll do it with countries, you can select some cells, go to the Data tab and choose Geography. And this will look them up and can give you some useful information about each one. So for example, Cambodia, there's their flag and some other things about that. The electric power, tax revenue, population, physicians per thousand, armed forces size, things like that. And if you want, you can just extract for all of these. Let's say the image, this will be the flag. Let's say we want to extract the population. So you can look these up very, very quickly and easily based on what's in it there. And this can be refreshed. It's a new feature in Excel, which is being increased to a lot more than just geography, including very soon you'll be able to do it for types of food, for different medicines, diseases, animal species, dog breeds, things like that. So another thing that I showed you is called a waterfall chart. I love this when it comes to explaining down and ups. So you can select some data, you can go to Insert, and you have this. This is from Excel 2016. All you have to do is mark these as a total by clicking there, right-clicking, and set as total. You need to click twice sometimes, make sure that all of the others are grayed out, and then you can set it as a total. So that can look pretty good like that, and as I said, it's really good for looking at these sort of changes. Note that these aren't the exact changes to R, it's a lot more complicated than that, but this is roughly what I used for my calculations to show you a demo of that. So let's now look at Cambodia versus other countries. So over here, we can see that Cambodia is actually the 7th lowest country in the world in terms of cases per million. And I'm going to show you how I calculated that. It's public information. It's just a little bit of adjustment and assumptions that I'll go through all of those with you. But this is quite the triumph. And I know what you might be thinking, well, that's because it had not really much COVID until late February, and so now it's playing catch up and it's accelerating a lot more than these other countries are. But let's have a look at whether that is happening. So I get this data from a site called Worldometers, which I use. But the issue with Worldometer is if you look at total cases per million and you sort it from lowest to highest, you get something like this, which has a combination of things like cruise ships, other things that are not really considered countries like by the UN, like Western Sahara or Macau, and other places that are not really able to compare for other reasons. So I make some assumptions to avoid a process like Tanzania. Tanzania, although it is a large country in Africa, they decided in May 2020 that they were not going to report any new COVID cases. This really happened. You can look it up. They suspended reporting any new COVID numbers for almost a year now. Since then, they've not taken any measures. They openly mock other countries that are taking measures and not ordered many vaccines. So this country had a lot of issues, and I need to exclude this from the counts, otherwise it's going to give me inconsistent results. So the exclusions and the only assumptions that I'm making are as follows. I'm excluding anything that's not a country, like my hometown Gibraltar, which coincidentally is the lowest in the world for vaccinations, the highest in the world for vaccinations per capita. Any place with less than 100 cases, I'm excluding. Any country with a population of less than 1 million, considered a small country, the way I'm looking at it here, and any place that is not formally reporting testing consistently. Cambodia is, but other countries that are not, I'm not relying on that in my comparisons. So what I get is this as the comparison. So Cambodia is 7th lowest in the world, as I said, with 267 total cases per million population. And Vietnam is number 1, our neighbors. They're doing fantastically well. Laos is also around here, but I excluded that because it's had fewer than 100 cases. If we look at Thailand, it's not too far behind, but it's still around double what Cambodia is. But then if we look at other kind of Western countries, Finland is the best performing European country, and then the US is 95,000. These stats are at the time of giving this webinar, which was the 12th of April, but it's 360 times as much. So it's not like Cambodia is going to ever catch up to this. And we're not talking about cases overall, we're talking about cases per million in the population. So it's so far behind if we compare the two places. But is it accelerating? Is it going faster than the other countries at this pace? So a very common chart that was made near the beginning of COVID was this. How can we compare countries if one of them starts getting cases in March, the other one starts getting cases in July? This chart was made that starts with day 0, whenever that country reached 100 cases. And then this is, day 1 after 100 cases, day 10 after 100 cases, etc., etc. So if we compare Cambodia's current outbreak, not when Cambodia reached 100 cases, including imports, which was around March, April. Cambodia, from its current outbreak, compare that to these countries. We can see that the best performing ones, it is behind those, is ahead of those. But when we're talking about other Southeast Asian countries or other countries of similar sizes in the West, like Ecuador and these 2 European countries, the change is so much higher. The curve is much steeper than we see in Cambodia, which until the 5th of April was a linear trend, as I explained. So this is before the huge uptick that we've seen since. I'll get back to this chart after that, including those. The reason why I've included these seemingly random countries is I've tried to have places in the region and other countries of similar sizes around the world in different continents. So after the huge uptick, we see that it looks like this. So it is accelerating here, but we can see that this trajectory is not as high as we're seeing in other European countries. And since the 12th of April, this trajectory has actually slowed down as well. So it's not really increasing at an exponential speed where it's getting more and more steep. It's kind of leveling out a little bit. What we call flattening the curve has happened. But it's been less than a week since then, so it's too early days to tell what the trend is just from this bit here. Adding in more countries, we see that Cambodia is still very low, and when we add other European countries, like this is Germany, it's just a night and day difference. Even this is post this is the sort of uptick to 500 or so cases. We see that trajectory compared to this, and it's just night and day different. And in case you're thinking that Cambodia is testing not enough, I will get to testing later on in more detail, but Cambodia is testing more per capita than these countries were at that time. Remember that when we were seeing these outbreaks for most countries in the West, this was happening in March, April last year, which is when they just didn't have any testing capacity, which they much later increased. Mostly towards late April, May, June, they started getting a lot more capacity. And since then, they've got way more than Cambodia. But at the time, compared to how Cambodia is now, Cambodia is certainly returning less positive cases per test, which is what I'll talk about more later as well. So where were these countries 30 cases after 100 days? Look at that. This is the night and day difference. Cambodia is 1.7 thousand from the current outbreak, I will say again. UK, France, Germany are orders of magnitude higher. Like This to this, UK is 20 times higher. France and Germany way, way, way more than that. And yes, Cambodia did have an uptick more than 30 days after, between 45 and 50 days after, but still it doesn't come anywhere near comparing to this. If we compare it to other Southeast Asian countries, again, Myanmar that had its later outbreak. Well, Myanmar and Thailand, this is comparing both of the later outbreaks. Myanmar last summer and Thailand in December, January, just gone. It is still a lot less. It's a lot less. But is it hidden? And this is again to do with testing that I'll get back to later on. So another poll question, where do you get your updates from? And for this one, I got results that said Khmer Times was by far the most. Quite a lot of people from CNE, a few people put from the stuff that I publish as well, which is nice. I'm glad you're finding that useful. So let's go to the next section, which is my data sources. By the way, if you like this feature, this is a PowerPoint feature that I love called the section zoom. It's not very well known. It came out in 2019. Insert zoom and summary zoom. It's relatively easy to do. What you need to do is have your section header be a different kind of slide like this, so it looks consistent. And then once you've got that, you just click where you want it to happen, for example here, and I can go to insert zoom and summary zoom. I can tick on the ones that I want. So for example, I could tick on this one if I wanted to do that one. And then once it's loaded it here, you can click on those and delete the ones you don't want. I usually like to go with 6. I think 6 is a good number. And then automatically, it's got this feature that you can click on it and it does this cool animation into that. Goes through all the slides in that sequence, but then you can click on any one to launch that you want. If I go here, it goes through my sequence, and then at the end, it comes back to this, which is quite nice. So that is the zoom feature. I love that. Also, PowerPoint has built in stock images and icons if you're using Office 365, which I love as well. So highly recommend these. It posts new ones every month. It's got thousands and thousands for you to choose from. Love this feature. PowerPoint is something I love almost as much as Excel. So back to this, my data sources. Beware of fake news. I was seeing this sort of thing posted about places you could go to in Russian market to get vaccines, locations, but this wasn't published by any news source affiliated with the government, and it ended up being not true. And unfortunately, a lot of people went to these locations, realized that they weren't able to get tests, and then realized they weren't able to actually get vaccines physically there, got upset, they wasted their time. Beware of this. If you want something to happen because you're eager to get the vaccine straight away, then just be aware that if it doesn't come from an official place, it might not be real. Later that week, actually, the government posted the formal way to get vaccinations for foreigners with work permits. And it's been really, really easy. I got mine done a couple of days ago. I posted how to do that by the official instructions, and a lot of other people said as well that they were able to do it quite seamlessly. So every morning when I wake up, I check the news in 3 different languages: English, Khmer, and Chinese. And I work very closely with CNE, Cambodian News in English. We're messaging a lot of times during the day, but particularly as soon as the results come out. And so I even make charts for them. As I said earlier, they are a very good resource for me, and I wouldn't be able to make my daily updates or even this webinar without their help. So here we are. This is a web browser I have with a lot of my data sources. Firstly, the Wikipedia page is actually surprisingly good for COVID in Cambodia. It has the number of vaccination numbers in a much clearer to follow way than anywhere else I've seen. This is up to date for the 14th of April. And it has other charts like this. It has cases and recoveries. It has breakdowns by province. It is kept up to date quite well. As you can see here, it's from the 14th, which is the day that I'm currently reviewing this. So that's done pretty well. It's even got this map as well, similar to the map that I am doing. So that is a pretty good one. I do also like the Facebook pages for the Ministry of Health and the CDC. The CDC is where I get my test numbers from. And then this is CNE, so they always have the daily cases and other important information. The Khmer Times that I use as well, which has a counter up top here, and this has probably the most number of COVID related articles. So I do scroll these to get more things about it, but I always try and verify things from multiple sources, usually at least 2. So here I have fresh news, and what I find invaluable is Google Translate. I have it as a Chrome extension on my Microsoft Edge. If I click translate this page, then it will translate them quite fast like this. And then I can click on every sub-article to get the translation. This is the site where I get my vaccine information. This is where the Financial Times and Wikipedia also get it. It is a very, very good resource. On this, you can just translate sub-pages. There are other ways to work with translations with Google Translate. For example, this is the Chinese one, and I have it set to auto-translate so that every sub-page that I go to also gets translated. Now, don't expect that this will make perfect sense in English the way you read it. For example, it calls it new crown pneumonia instead of COVID, but it is good enough to get the gist of what's going on. Kanla province is Kandal province, but once you kind of understand what it's doing and where it could go wrong, you can read a sentence and it makes sense, which is fantastic progress from artificial intelligence perspective. Then the WHO actually does a report once a week, although they are a little bit behind schedule, which has some really useful stats about that, particularly ICU numbers, for example, that I haven't seen anywhere else. Over here, 35 up till the 29th of March, and some other paragraphs here that are quite useful to understand. Also the positive rate that I'll talk about later on as well. Then this is the CDC, the Center for Disease Control, Ministry of Health. They have a daily report as well. They don't publish this on the day of, sometimes they're a bit late, but it has some key statistics, some charts, even a map chart like this, and a lot of stuff around sampling contacts as well. So that's pretty good. On Twitter, I follow Noan Serebot, as I mentioned earlier. AKP, this is a government news website which has the highlights only or mostly, and this is Open Development Cambodia has a dashboard and some other resources that you can download about the reports. This is another dashboard from the CDC over here with number of cases by province. You can even Google Translate this and it gives you a little bit more of a glance. And then over here, there we go. So this is the name of the province, which it doesn't get them all, like central is Kandal, but it's good enough and you can understand what's going on there. The Financial Times has a vaccine tracker showing country by country. This actually shows that Cambodia is not doing badly at all. If I go and sort this by doses per 100 residents, Cambodia, as we can see, is over here. It's not bad. It's definitely near the top end of countries like that. And it is rising quite fast as well. If you click on it, you get the news source. And for Cambodia, that will take you back to fresh news. Also, this is a really good resource that a person I'm collaborating with, Dixie Can is a Facebook name, is making, which has an up-to-date remark with what's going on with restrictions, regulations. Each color is a different mapping layer that she explains what to do, and you can tick on these to see the ones that you want to see. Recent contact tracing, positive cases, etc., etc. This is a really, really good resource that I know I'm working with her closely, and she's looking to expand as time goes on. Another incredibly useful trick that a lot of people are unaware of is the ability to filter your search results for news. So let's say that I look for Cambodia COVID, but I actually want to go to news, but I only want the recent stuff. So I don't really want something that's 2 days ago, 1 day ago, etc. I just want stuff that's recent. So what I can do is I can go to tools, and most people have never clicked on this, but I can go to recent and choose the last 24 hours. And it only has stuff within that date. Past hour if I want something that's very, very, very new. And I can even choose a custom date range. Or something that I also like to do is I want a certain number of hours. To do that, it's a little bit more complicated. You need to go into the URL itself and then navigate to where it says this and H and SA, and then you can type in, for example, 5, and it will be the 5 hours. If you go to past 24 hours, instead of H and SA, you'll see D and SA. But the same applies. You can click D4, and it will be the past 4 days, even though that's not an option in these drop-down lists. It has past 4 days, but once I go to week, it's disappeared from there. So that is a really useful trick that I use. Back to my Zoom slide picker. Let's go into COVID testing. So some people say, well, that's all well and good, but is it hidden? How do we know that the cases are actually what's happening? So there are 3 possibilities that could happen. They're being detected, but they're not being reported. They are not testing enough, or they're testing, but they're testing the wrong one. So the Cambodian Ministry of Health works with 3 independent organizations, WHO, the Institut Pasteur, and the CDC, the US CDC, in order to take its COVID approaches. And although the WHO is in most countries, the US CDC is very, very involved here with COVID, but usually it isn't in most countries. And the Institut Pasteur is something that is an organization you only really get in Cambodia and in France, but it's specific to this region. And they are doing a lot of the testing and have been since the beginning of COVID. So are they not testing enough? People are of the opinion that Cambodia's test per million is very, very low, and is when you compare to many European countries, but it is actually higher than Vietnam and Taiwan, 2 countries that are deemed globally to have a fantastic and effective COVID approach. But that's not the most important metric, particularly when it comes to a specific outbreak, because the most important metric by far is something called the positive rate, or the number of cases per 1,000 tests is how I denominate it. At the time of doing this webinar on the 12th of April, Cambodia ranked 8th lowest in the world overall, and 13th lowest in the world if you just take the numbers from this outbreak and compare that to the other countries since the pandemic started. So over that metric, it's doing actually very, very well, which could imply that the cases are being tracked. Now, almost every country in the world will have undetected cases, but the question is how many of those undetected cases are there that exist? And by virtue of this, I would say that Cambodia's exists, but it's nowhere near as high as other countries. To put into context, Cambodia is currently 6 cases per 1,000 tests. This is even verifiable to the number published in the report on the 29th of March by the WHO 2021. And if we compare that to the Worldometer statistics, it goes from 6 to 76 in the US, which means US is likely to have 13 times as many cases that are undetected as Cambodia, which is very, very, very high as a proportion of the current cases that are going on at the moment. When I say Worldometer, so this is a website that I've been using quite a lot since the beginning. And if I scroll down, then I could see all the countries, and I can sort them by any one of these columns. So if I look at total cases per million, I can sort that down. And this is after that, I went through my adjustments to get to how Cambodia fits in. If I look at other things like total tests and number of cases, do some division, then I get to this ratio of cases per 1,000 tests. So Cambodia has actually increased dramatically its testing since before the outbreak. It was testing roughly about 2,000 a day pre-outbreak, and that went to about 3,000 a day early in the outbreak, and now it's between 6,000 and 7,000 per day afterwards. So 2 and a bit times more than it was testing before the outbreak. And the cases per 1,000 tests by day is higher than it was before the outbreak, as you might expect, but it's still relatively low, although it is kind of coming up. This is total. As we can see, there are more cases here and roughly the same number of tests, so we see it's rising as we might expect. Contact tracing is being done here, and they've done a good job with the QR codes and things like that, but contact tracing, as we've seen in basically every other country, is very, very, very difficult to plot out an outbreak completely. So it is helpful, but it's not as good as it could be. And the testing numbers could still be higher, particularly with this uptick that we saw a few days ago. New test centers are opening soon. This was announced in late March, but I haven't heard any update directly on when exactly that's going to happen. All right, what's next? Final part. So with any measures, for example, the curfew, after the measure comes into place, then there should be fewer people that contract COVID. Curfew is something that has been done by many countries in the world, both regionally and even in Europe. So fewer people are likely to get it, but then there's an incubation period of a few days. Roughly, they say that by day 7, about half the people will have shown symptoms. And then it takes a while for them to be taken for tests. And then from the tests to the results also takes a few days. So all of this together, when a restriction is placed, you shouldn't see anything coming out of it for around 3 weeks. So any results that come before it, whether it's up or down, are usually completely unrelated to any measure that's been taken to reduce this. So Cambodia is amongst the countries that are doing better, as I showed you earlier. And what's interesting is this thing that I built on my website. You can access it, which allows the user to actually compare and contrast different countries and their outputs across time. So let's have a look at that. So this over here is on my website. It's public, anyone can access it. I'm going to make it full screen, and I'm going to show you the flexibility of what you can do with it. So you can choose, you want to see the highest to lowest or lowest to highest, give a ranking. So let's say I want to see the top 25 countries in lowest to highest, and I can choose cases per million. That's probably what I'd use. I'm going to sort them the other way, like this. And I can see that Laos is the lowest one, but it goes down. 25 countries, and here is where they stand. But what's very interesting is that almost all of these are effectively in the middle of the world. We call in geography in the tropical regions, which is north of the Tropic of Capricorn, which is roughly here through South Africa, and south of the Tropic of Cancer, which is roughly here, around where Taiwan is. So the equator is halfway through the Earth, like here, but we see that there are the tropical regions up here. And as we can see, the middle of Africa and the middle of Asia is where you find all of these happening, apart from a couple of exceptions like China and New Zealand. You can also hover over things to get what's going on in that country by date, some key stats. You can switch what you want to see if you want to see deaths per million, etc., etc. It's organized like that. And here are the excluded countries, which are usually countries with 20 or fewer cases. But if you increase this all the way to, well, if I go all the way to the max, there's 169 countries. So half of that is roughly 85. And as we can see here, there's not a single country in Europe in the top half of the world, the half that's performing the best in terms of cases per million. Isn't that crazy? And when we go to the Americas, no North, no South American countries, apart from ones right at the top, and in Central America. And even in Southern Africa, we don't see those countries. So yeah, it's really all seems to be somewhat related to this, the middle of the world. If I go the other way around and see highest to lowest, this is where I get all of Europe, all of North and Southern America, some of Central America here, and the southern parts of Africa as well. Now, all of these are statistical inferences, so it doesn't mean that just because you are near the equator, you are going to have fewer cases per million. This is just one of the factors that could lead to it. And again, this is possibly to do with the temperature, it's possibly to do with the humidity, it's possibly to do with the fact that because people are in hotter climates, they're more likely to spend time outside, they're more likely to get more vitamin D. So we don't know the exact reasons for this, but these are things that could contribute. I have other things like this where you can choose to sort of sort things by charts and see the trends over time. And here it has kind of like statistics that it has a summary narrative based on that. You can also filter it if you just want to see, for example, Asia. You can filter it for that, and then it will show you just Asia for all of these statistics. So you can play around with this. This is on my website. back to PowerPoint. So although this is by far the worst outbreak Cambodia has ever seen, it does not seem to be rising anywhere near as fast as other countries. Even with the uptick that happened after this chart is showing, it's still not as steep as we're seeing in Western countries. So the last few days have seen a steep change like this, although it is gone down since here in the period from the 12th to the 14th of April. It's mostly around this level, which is good. And although terrible, I just want to leave you with one final thought, which is back to what I started with. The vaccines are coming. They're coming fast. As I said, 75,000 yesterday, 85,000 the day before, being the 12th and 13th of April. And it is because of this outbreak that Cambodia is really putting a lot of effort into purchasing and organizing supply of vaccines, as well as trying to go to these ambitious targets of vaccinating 1 million a month, which so far it seems to be achieving with. So it's because of this outbreak that potentially Cambodia might be fully vaccinated sooner than it would have been had this outbreak not happened. And if you enjoyed this video, particularly the tech tips, I have loads more tech tip videos on my YouTube channel that you can scroll to and navigate to from this one and look at those, because I have weekly videos on Excel, PowerPoint, Power BI, Google Sheets, Zoom, Teams, and they have loads of tech tips and tricks like the ones that I've showed you very briefly on this video. Thanks for watching.